It's about rewarding for good performance and penalty for bad performance. And there are multi-asset elements in the NHS because the healthcare system is so complicated. We focus only on one element, which is timely access to care. We undertook this research into performance-based contracting for outpatient medical service. Contracting is a mechanism for the purchaser to buy service from service provider. There are many types of contracts. For example, block contracts, fee-for-service contracts, and performance-based contracts, which are actually the focus of our research at this moment. Block contracts actually allows the purchaser to pay the service provider with a fixed lump sum payment. And in service for C service, the service provider is rewarded for the activity provided. Unlike the fee-for-service contracts and block contracts, performance-based contracts actually, the payment in these contracts not only depends on the service provided, but also the performance and outcome of the patient treatments. And there are many different types of performance-based contracts. And our threshold penalty performance-based contract is one of them, which is the best. If we look at the past history of the payment scheme used in the United States, in early stage, they use fee-for-service contracts, but now performance-based contracts become popular. And they don't call it performance-based, they call it pay for performance, or P for P in short. And some states in the United States have actually implemented P for P contracts for their healthcare service. And this intensive discussion of the future healthcare structure in the United States and also in other countries in the world actually underscore the importance and also timeliness of our research. Similar to the American system, the NHS in the UK has also modified their payment schemes several times. In early days, block contracts were used. 10 years ago, payment by results was introduced. And the early version of the payment by results is close to fee-for-service contracts. The current version of payment by results is close to performance-based contracts. And of course, more change and improvements are needed in the payment by results approach. In any contracting framework, there are multiple participants. And healthcare service gives an excellent example of a service system with multiple participants. In our research setting, there are three types of participants: the National Health Service, or the NHS, the service providers such as hospitals and clinic centers, and the patients. So our research focus is on designing incentives and compensations such that the incentive or interest of the service provider is aligned with that of patients and the society as a whole. In theory, patients can have more choice, but in practice, probably it's difficult for different reasons. First, a particular service provider may have not enough capacity to provide the service to all the patients who would like to get service from that particular service provider. Secondly, patients may not have enough knowledge or time to do research to find out the best choice for themselves without investing time.